Many of you consider sports your passion, the one thing that can clear your mind from anything. Many of you have probably also had an injury or a surgery that has taken away your passion for just a short time. Now just imagine if sports were taken away from you forever. You can never again play what you love to do the most, ever. Imagine if you had to have not one, but 3 open heart surgeries that took away your passion forever. Fortunately for you, this doesn't have to happen, but it did to my brother. Zach was born with hypoplastic left heart syndrome, or HLHS. This means that only the right side of his heart had fully developed. Only 1 out of every 4,344 babies are born with this syndrome each year. Because HLHS is rare, there can be a medical downside, many unknowns. HLHS requires numerous operations, various treatments, and limitations that take more than 2 hands to count. Hypoplastic left heart syndrome is a congenital heart defect, which means that it is present at birth. The left side of the heart is undeveloped or too small to function correctly. This means that blood does not flow through the heart properly. As a result, the baby shows symptoms like purplish blue skin and lips, they'll have difficulty breathing and feeding, and they'll be sleepy or unresponsive. If a baby has these symptoms, the doctor will then do an echocardiogram, which uses sound waves to show pictures and videos of their heart and how it is functioning. From here, the doctors will go into the treatment options. In the early 1980s, HLHS was fatal. The Levine Children's Hospital reported that 95% of the children born with a congenital heart defect died before they were 1 month of age. Over the past 30 years, there has been a tremendous advance in the treatment and options for HLHS. HLHS has 3 treatment options, left up to advice from the doctor and then decisions by the parents. The first, but worst option is to do nothing, and the baby will pass away a few days later. Less than 5% will survive if they go untreated. Secondly, there will be a series of 3 open heart surgeries called the Fontan sequence. The Centers for Disease Control and Prevention explain the surgeries. The first surgery is called Norwell. It's done approximately 1 week after the baby is born. For the next 5 weeks, the baby will have to stay in the hospital. When the baby is 4 years old, they'll have the second of the 3 surgeries called the bidirectional glandular. For the next week, the baby will have to stay in the hospital. Between the 2nd and 3rd age, there's a possibility of a supply surgery to close off the collateral vessel. Finally, the last stage in the Fontan sequence is the Fontan operation at around 3 years of age. Even if the surgery is completely, the patient still has a 60% chance of living until their 3rd birthday. In addition to a minimum of 3 surgeries, the patient will have to take daily medications, enalapril, digoxin, and baby aspirin twice a day for the rest of their lives. The 3rd option for HLHS is a heart transplant that can be done at any point in their lifetime. A patient's lifetime also includes numerous limitations, especially contact sports. When my brother was younger, he absolutely loved playing t-ball and wanted to play football. Every fall, Zach would bring the football brochure home from school and place it on our kitchen counter, hoping for the day my parents could say yes. When he got to the age when my parents had to tell him he could no longer play the sports he loved, he was devastated. So were my parents. Unfortunately, sports aren't only the limitation. Zach is limited to the things he can do at theme parks and water parks. He can barely go on any rides. Zach should avoid hot tubs or only spend a couple minutes in one. Finally, for the rest of his life, he can never have caffeine. In conclusion, hypoplastic left heart syndrome requires numerous operations, treatments, and limitations. More research needs to be done to better the chances of survival rates. The next time you hear someone say, I don't want to go to practice today, or talk about how hard life is, just think back to the people who would love to go to practice and would love their life to be normal. I am so lucky and truly blessed that my brother is alive and has made it to where he is today, to make the memories we have made, instead of him being somewhere else, for instance, heaven.